Okay, let's talk about something that I have not seen a lot about in the nursing world, and that is taking care of a brain dead patient, which actually happens more than you think. So, I am a travel nurse at a level one trauma center, and I've been working for probably about 6 weeks, and I've taken care of around 4 to 5 brain dead patients. So, typically, these patients will come in after a serious accident or injury, like a motor vehicle accident, or gunshot wound, or a fall, anything like that. And typically, these patients will have like a few different brain bleeds, subarachnoid, subdural, depending on what happened. But no matter what type of brain injury you have, if your brain stem swells, that's it. So, what we do as nurses, first thing you do, patient comes in after some sort of traumatic brain injury, we check for a cough and gag. When you suction them, do they cough? Do they gag? When you flash a light in their eyes, do they have a pupillary response? Let's get the pupillometer. Is there a pupillary response? No? Okay, we're talking to the doctor. Once the team is aware and they talk to the family, we proceed with brain death testing. And that has to be performed by two doctors of two different specialties because it's such a big deal. And we do a few different things. So, one, we do the apnea test where we turn off the ventilator, and we're not necessarily looking to see if you'll breathe on your own. I mean, basically, yes, but what we're actually looking at is if you can get rid of your carbon dioxide. Can you blow off this air? Yes or no? Typically, that they'll turn off the vent for anywhere from like 2 to 5 minutes. And if your carbon dioxide does not come down, then you failed or passed the apnea testing. The two head doctors of the teams will also check pupils. There's another procedure that they will do. I'm blanking on what it's called, but basically, that's when you put water in the patient's ear, and if their eyes turn towards that water, brainstem is intact. If they do not turn, brainstem is not intact. And at any time during this test, you cannot have any arrhythmia or we have to stop the test. So most patients are on pressors, and that's just to keep, the heart beating while we do this test, or the heart beating in general. From a nurse's perspective, it is very important to be there for the family and help them with this transition. So I personally like to let the doctors, come in, tell them what's going on, what we're about to do, and then they'll leave. And then I'll go up to the patient's family and like, I know we just threw a lot of information at you. Do you have any questions? And then I kind of help them navigate the next steps.